Neighbors found him several hours later, and he's not remember any circumstances. Surrounding the event. Blood sugars. Monitored. Diagnosis of PM was given. All right. The only other positive finding was beta streptococcus, group B, which grew the urine culture. All right. So, what are we coding here?
Mm, the diabetes.
Here's our discharge diagnosis. So what's our code, Taylor? How are we going to code this diabetes mellitus? Where are we going to go first?
To diabetes.
Talk it out with me. Where are you at?
In the diabetes section.
In the diabetes section. What type?
2.
Type 2. Do we have any complications with it?
No.
What about our blood sugars?
It's still low.
Were they low or high?
Oh, high.
They're high. Okay, because they needed to do insulin therapy to lower them. Okay, so this is just a case study where you don't have the rest of the chart, but you would you would probably have a lab in there that would tell you how high it was or whatever. But we know from reading this that this patient had high levels of blood sugar. He had fallen at his home. They found him several hours later. He didn't remember anything. So he probably passed out from them being so high. Okay. So they brought him in. They realized that they're going to need to give him insulin therapy to lower that blood sugar. And they diagnosed him with new onset type 2 diabetes. So we're going to go to diabetes type 2. We're also going to do with what? What's another name for high blood sugar? You know this word? Hyperglycemia. So you're going to go diabetes with hypoglycemia. What code is there?
E11.641.
That's 641. You're under hypo.
Uh, um, E11.65.
B11.65. Okay, so the difference between hyperglycemia is when you have high levels of glucose in your blood, right? Hypoglycemia is when you have low levels of glucose in your blood. Okay. All right. So now what's our other issue here? What do they also have? What do they also find? They found that she also had a UTI. So what's our code for that? Where are you going to go in the index?
Um, to urine.
No. You're going to go infection and then urinary tract. What'd you come up with?
Um, N39.0.
N39.0. All right, what about our beta streptococcus? So how would we look that up?
Um,
In the index, go to streptococcus. So it's at the bottom of 328. And what kind of streptococcus is it? Which one? A, B, or D?
A.
Right here it says the only other positive finding was beta streptococcus group B, which grew from the urine culture and was treated with oral antibiotics. See that?
Mm-hmm.
So which one? So what's our code?
B95.1.
Yes. Good job. Another one. Let's do this. Type 1 diabetes. Brought in a comatose state to the emergency department by friends. Admitted with ketoacidosis and was resuscitated with saline hydration via insulin drip. After regaining consciousness, he reported that the morning admission, he was experiencing nausea and vomiting. Decided to not take his insulin. Not a very good idea. No, because he had money. Following morning, his lab work was normal. So our discharge diagnosis, diabetic ketoacidosis. Juvenile onset diabetes. Okay, so what do we code here?
Um, E11.10.
Say that again.
E11.10.
What's E11 mean?
Diabetes.
What type diabetes does he have?
Type 1.
Okay, so E11 is a type 2 code.
E10.10.
E10 point what?
10.
E10.10? Okay. Did the patient pass out? Did they have a coma? He was brought to the ED in a comatose state. See that?
Mm-hmm.
Okay, so would it be 10?
E10.11.
Huh?
E10.11.
Yes. B10.11. Wait, hold on. No, that's with kids. All right, now what else is going on? He didn't take his insulin because he had not eaten. So remember in the slides when it talked about underdosing?
Mhm.
So go to T38 for me. And let's look for the underdosing of insulin. It says adverse effect of insulin and oral hypoglycemic drugs. See that? And then the next one says underdosing of insulin and oral hypoglycemic. You see that? Like get past all those poisoning ones because it's not a poisoning. And the last one says underdosing. T38.3X6A.
Yeah.
Okay. All right. And then also we need a patient's intentional underdosing of medication regimen for other reasons, which is Z91. Make sure that's still 0.128. Nope. It's yep. Z91.128, patient's intentional underdosing of medication regimen for other reason. And look, make note of these other ones. So when sometimes a patient will underdose because of financial hardship. So there's a code for that. In each of these, see what else. And then all the other reasons fall underneath the other. So they added these financial hardship ones to show when so that we could track how many patients don't get their medications because they can't afford them. All right. Let's do another one. Patient with type 1 diabetes mellitus. Out of control, was admitted for regulation of insulin dosage. He has an abscessed right molar. Which was determined in part to be responsible for his elevated blood sugar. So when you have an infection going on in your body, that also can be responsible for high elevations in blood sugar. Patient had been in the hospital 3 weeks earlier for an acute myocardial infarction. So, or acute MI. Got more in the posterior wall. And the EKG was performed. Check status. All right, so we haven't gotten to this section yet because you're going to learn more about this in when we get to the circulatory system. So, but this one, we're going to code a myocardial infarction at this tooth. And then they're uncontrolled. Right. Diabetes plans. Okay, so when we are coding myocardial infarctions, what's a myocardial infarction? Do you know?
No, ma'am.
Okay, myocardial infarction is a heart attack. It's another name for a heart attack. Okay, and when we're doing myocardial infarctions, if they occur less than 4 weeks ago, and you have an EKG was done to perform that the it was elevated during the admission, then we need to code that that STEMI as an active myocardial infarction. Okay, so when it's further than 4 weeks, then we're coding it as an old myocardial infarction. But this one, it occurred less than 4 weeks ago, and it was elevated during admission. So we need to code it. It's not going to be the reason that the patient came in. Okay. So we're not going to code it as our principal. So the patient did not come in for a myocardial infarction, a heart attack, but it's still an issue. It's still lingering. It's still active. So we're going to list it, but it's not going to be our primary diagnosis. So the reason why the patient came in is for what?
Um, regulation of insulin dosage.
Yes. So what's our code for that? What's our complication with the diabetes mellitus?
The abscess right mode.
Well, that's not a complication of the diabetes mellitus. So the abscess right molar is just like one of the reasons why it's elevating the blood sugar, but that's not really a complication. So the abscess right molar was not created because of the diabetes mellitus. They just have an abscess right molar. Okay. So, but our complication of our diabetes is that we have the elevated blood sugar. So just like our last one that we did, what is going to be our diabetes mellitus code? Remember?
E10.
Huh? What is it?
E10.
Uh-huh. E10.
0.65.
0.65. Okay. What about our abscess tooth? You find it yet? Go abscessed.
K
Uh-huh.
04.7.
That's it. That's it. All right. What about our infarction? I'm going to go infarct in the index. Going to be the STEMI. And see how it goes infarct, and then you're looking for myocardial, myocardium, myocardial acute with stated duration of 4 weeks or less. See that?
Mm-hmm.
And then you're going to go down to STEMI. ST elevation. It says ST elevation. And then inferior posterior. I-21, right?
Mm-hmm.
Point what?
0.3.
Mm-mm. Says inferior posterior transmural Q wave. See that? I-21.11.
Oh, okay.
See that?
Mm-hmm.
We're gonna learn more of that when we get to circulatory. So this is just like a precursor into your circulatory system, just because it came up with it. Okay. So an I-21.3 would have been unspecified site, but we have a site. So it's involving the right coronary artery or the inferior posterior transmural. Okay.
Mm-hmm.
Type 1, and it also says type 1 ST elevation, myocardial infarction of the inferior wall. See that? I-21.1. All right. Awesome. Okay. So we had K 4.7 and I One moment. That's it. Let's do a malnutrition one. Patient was admitted for severe malnutrition. Hematuria secondary to amyotrophic lateral sclerosis. What's hematuria? Remember?
Mm. Mm-mm.
Hmm?
I don't remember.
All right, so remember blood in the what? So this first part's the blood in the urine, okay?
Mm.
Right. Because of malnutrition. All right. All right, what are we coding? We know she definitely has this malnutrition because what? She had a procedure done for it, right? They had to put a feeding tube in.
Mm-hmm.
So what are we going to do? We're going to go to malnutrition and then what?
Severe.
Say it again.
Severe.
Severe. Yep. So what code we come up with?
E43.
E43, yes. So what's our next? Where do we go now?
Hematuria.
You can. You can go there. What's the reason for the hematuria, though? Your sclerosis. So your sclerosis is going to be coded ahead of that.
Mm.
Okay.
Okay. Mm. G12.21.
G12.21. Yes, ma'am. Okay, and another way that you'll see this in the chart is going to be if you see it as ALS. Okay, it's the same thing. It's a nervous system disease that affects the nerve cells. In the brain and the spinal cord. Okay. All right. So that is G12.21, our malnutrition code. And what's our hematuria code?
R31. R31.9.
That's it. All right. I just All right. So she had type 2 hypoglycemia. They treated her with intravenous. D5W. UTI was also present, treated with antibiotics. Her urine culture grew Calbicilla, Calbicilla, sensitive to Kypro. What's Kypro?
Um,
Or Cipro. It's Cipro. It's not Kypro. Cipro. It's an antibiotic. It's a certain antibiotic, so it's sensitive to that. She then developed mild congestive heart failure, probably secondary to her hypoglycemic reaction, which responded to oxygen and rest. Her diabetes regimen was restarted at a lower dose. And so she has CHF secondary to her hypoglycemia, type 2 diabetes mellitus, UTI. What are we going to code here?
type 2
Mhm.
diabetes with hypoglycemia.
Yep. Which is?
E11.641.
Did she have a coma?
Oh, oh, E11.649.
Yes. 649. What else do we have? Going to the heart again.
CHF.
Mm-hmm. Hold on 1 second. Taylor, I gotta take this phone call. Hey Taylor, I'm so sorry. I had to talk to my son at school. He was not behaving. All right. So, where were we? You finished up? What we got?
I think so.
What's our heart failure code?
I 50.20.
All right. Y.20. Let's see. All right, so I 50.20 is for systolic congestive heart failure. Do we have anything in any of this that tells us what type of heart failure? So you can have systolic heart failure or diastolic heart failure, but this gives us nothing to tell us what type. So when that happens, we need to go to I 50.9. Heart failure unspecified. Okay. So don't be afraid to use the unspecified code. Okay. When we don't have enough in our documentation, we do not want to use something that is not documented within the record. Okay. All right, so I 50.9 is our heart failure unspecified code. And then we also need one other or two other codes. So what else do we need?
The UTI.
Mm-hmm. What's that code?
T83.79.
No, it's just a regular UTI. Okay, so a T83 would be if you had a prosthetic device that's infected. So when you come up with T codes, remember that means that it's complication. T codes are used when you have complications of things, post procedural or a device complication or something like that. Regular just urinary tract infections going to come from your N codes, which is your genital urinary section. Remember?
Oh, N39.0.
Yes. Now we also need to code because the urine culture grew Klebsiella. So let's look that up. So if we just look up that Klebsiella in the index, what do we come up with?
B96.1.
B96.1. That is correct. Here we go. Here's an outpatient clinic visit. Patient with type 2 diabetes. Status post fabric kidney and pancreatic transplants. Follow up of a recent amputation of the foot due to oops. The healing gangrenous ulcer. Left foot. Secondary to peripheral vascular disease. Operative site. Healing nicely. And no evidence of infection. Discharge diagnosis. Status post left foot. Amputation. Status post kidney and pancreas. Transplant. And diabetes mellitus. Okay, so this is an outpatient clinic visit. So we know patient is coming for a follow-up, okay? Follow-up of recent amputation of the foot. So this is one of the times that our principal diagnosis, or our first listed, because this is an outpatient, right? First listed diagnosis is going to be a Z code, an encounter code. So let's go to encounter. One second, sorry. Okay, how you doing with that?
Um, I'm confused.
All right, so let's see. If we do follow up in the index, and then follow up is saying go to examination and then follow up. Do you see that?
Mm-hmm.
Okay. So then we'll go to examination, follow up. It's going to bring us to Z09. See that?
Mm-hmm.
All right, so that's our code. All right. So our Z09 is going to be our first listed. Then we need a diabetes code, right? So is it uncomplicated diabetes?
Um, yeah, yes.
Why would it be uncomplicated? See this part? Peripheral vascular disease.
Mm-hmm.
They have peripheral vascular disease along with their diabetes. It was the reason that they had to have their foot amputated. Okay, so we can't just code E11.9 because we're not showing this peripheral vascular disease. So look up type 2 diabetes with peripheral actually under, let's see. Yes, there it is. So it'd be under peripheral angiopathy.
E11.51.
Yes, E11.51. Okay. We need anything else? We need to say that I don't have a foot anymore, right? So acquired absence of left foot is how we're going to look that up. So let's do what'd you come up with?
I can't find it.
All right, so where are you? What'd you do? Where'd you go in the index? Which word did you look up?
Um, absent.
Absence. That's where you need to go. Absence of the foot. Acquired is in parentheses. That's our non-essential modifier. And what code is listed there?
Z89.43.
Yep. And what's next to that 3 in the index?
A check mark.
A check mark. What's that mean?
That another
Huh?
character. You need an That's not the end of the code. You need something
Exactly.
else at the end.
Yes. So we need to go to the tabular. And it says Z89.43 is acquired absence of the foot. But which foot is it?
The left foot.
All right. So what's our code?
Z89.432.
Z89.432. Very good. All right. What else do we have? What else do we need? What else would be significant here?
The transplant.
Yes. How do we look those up?
Go to transplant.
Yeah. So what was transplanted? We have
Kidney and pancreas.
kidney and pancreas. So what's kidney?
Kidney is Z94.0.
Exactly. And what's our pancreas?
Z94.83.
83. That's correct. Let's do did that already did that. Patient was admitted for evaluation of her adrenal malfunction. For-year history, hypertension and hypokalemia. What's hypokalemia?
Um, Low potassium.
What?
Low potassium.
Low potassium. Very good. CT of the abdomen suggested left adrenal mass. Discharge to return for left adrenalectomy following week. The probable adrenal. Hypertension. All right. Where do we go first?
Um, aldosteronism.
Hmm?
The A word.
You can go there. Go ahead.
E26.
Huh?
E26.9.
E26.9. All right. What's the next thing? All right. So they're having so the patient's having trouble with her adrenal gland, right? Um, if we go to mass, specified organ, not elsewhere classified, will direct us to see the disease by sight. Okay, so trying to do the adrenal gland mass. So do you see where, let's see, mass. If you go to mass and we don't see adrenal gland's not one of these, but then underneath it says specified organ, because we know it's the adrenal glands, right? But it's so our index is saying specified organ, not elsewhere classified. Then go to disease by sight. So then if we go disease, adrenal, and then specified, because it's not a hyperfunction, but we didn't actually say that, but it's a malfunction of the adrenal glands, and we think it's a mass. Okay, so we would pick specified, not elsewhere classified, E27.8. Make sense?
Yes, ma'am.
Okay. And then our hypokalemia is just listed as hypokalemia in your index. So what's our code for that?
E87.6.
E87.6. All right. We need to code anything else?
No.
Huh?
Or the history code.
The what?
The history.
Of what?
Um.
What's HTN stand for?
Oh.
What's our hypertension code? Memorize this one. What code set do we use?
I.
I-10. Okay.
Mm-hmm.
All right. Memorize that one. It's easier than looking up hypertension each time. Okay. All right. I think that's it for that one. More. Okay, let's do this one. Last one. Here we go. Uh, 57-year old male sent it to eye service clinic for retinal evaluation of diabetic retinopathy. Yeah, or a vision in the right eye. Diagnosed with type 2 diabetes mellitus 15 years ago. Currently taking glucophage. Severe non-proliferative retinopathy. All right. How do we code this one?
go to rhinopathy. I mean, yeah.
What is it?
Um, I'm stuck. I don't know.
Say again?
I said I'm stuck.
You're stuck where you stuck at. So in your index, you're going to go diabetes, right? Type 2, retinopathy, non-proliferative, right? And then go down to severe.
E11.349.
And what's that? What's next to that 9?
A check
A check mark. What's the check mark? Tell us.
to add another digit.
Add another digit. So let's go to the tabular. What is OD and OS mean? Okay, that's the right eye and the left eye. So our E11.349 is severe non-proliferative diabetic retinopathy without macular anemia, because we don't see anything that says macular anemia in our case study.
Mm-hmm.
But now we need a 7-digit to specify which eye. So it's saying the right eye is greater than the left eye. But is that saying that it's not in the left eye?
No.
No, it's just saying that the right eye has poor vision. He has greater retinopathy in the right eye than the left eye. So what's our 7th digit?
3.
3. Exactly. So what's our whole code? E11.3493. Make sense?
Yes, ma'am.
Okay. Now, what else should we code here? See this part? Currently taking glucophage. What's glucophage?
Um,
What? You can look it up.
a medicine for his
A
type
what?
medicine for his type 2 diabetes.
Medicine for his type 2 diabetes. Is it an insulin? Or is it a oral?
Insulin.
Mm-mm. It's an oral, the I guess it's a generic name for metformin. So metformin is your brand name drug, which is an oral hypoglycemic tablet. Okay. So what's my Z code for that?
Z 79.84.
Yes. C79.84. All right. Was this helpful?
Yes, ma'am.
All right, good. All right, well, we are at 11 o'clock, or like 5 minutes too. So, let me know if you have any questions, but you should be fine doing your homework on this section.
Okay.
All right. See you next week.
Okay. Have a
Do you have
good
any
day.
questions before we hang up?
Mm-mm.
Nope. All right. I'll talk to you next week, Taylor.
Okay.
All right.